Hello, ladies and gentlemen, and welcome to the Diana Falzone Show here on Paltalk. I am Diana Falzone. If you want to fight the effects of aging, or you've been searching for the fountain of youth, I brought in the man who's pretty much on the brink of discovering it. We have the owner and also the working physician of the Fountain Medical Group. You can check that out right now online, thefountainmedicalgroup.com, Dr. Todd Schlifstein, and also his beautiful assistant. And how do you say it? Is it not anesthesiologist, aesthetician? Yes, I worked that out. Rose Gabrielle is here today, and they're going to tell us what is the latest and greatest beauty fixes to fight aging, to look better. Everyone keeps hearing about all the new reincarnations of Botox. So welcome, guys. Thank you for being here.
Oh, thank you for having us.
Yeah, well, I want to kind of get right into it because so many people have very controversial feelings about fillers and I guess injectables and those kinds of things, yet when people do it, they become addicted.
I think a lot of people who haven't done it have a lot of apprehension, fear, maybe just because of news or press about it, that of all the bad side or problems from it, but not necessarily all the benefits you can get from it. And certainly anything done in an appropriate manner, in a reasonable way, and not overdone, can yield you good results. Anything overdone or done too much certainly can have negative consequences, just like anything else in life.
Right. It's like the frozen face where you see that woman who's just like, hello, darling, how are you? You're like, ooh.
And certainly you see a lot of that, but I think what we really try to feature is just a very natural appearance, hopefully more youthful appearance by using these things in the best way possible to give you a more natural appearance, so it doesn't look like you had anything done. If anything, you just look refreshed or renewed or rested, making you look better. And also emphasize that an injectable may make you look better, but certainly appropriate diet, appropriate exercise, appropriate sleep, not smoking, not excessively drinking, all these things have a factor in the way you look, protecting yourself when you go in the sun. You know, if you're smoking 2 packs a day, drinking a quart of vodka a day, and you're lying out, for 3 hours a day.
A quart of vodka?
In the sun, laying out in the sun every day with no protection, there's only so much we're going to be able to do.
Right.
So certainly a healthy lifestyle, eating, drinking, fitness, sun protection, smoking cessation, alcohol in moderation, as well as an enhancement of skincare.
Now, who are the candidates for someone who would need an injectable versus kind of what Rose does, which is really cleaning the skin, prepping the skin, keeping it youthful, hydrated? Those are kind of the preventative ways through different sorts of facials. But is there a place where there's no turning back, like somebody is just, set?
Sun damage is the worst turnaround. It's hard to correct that. That's why always wearing sun protection is good. I think that usually anywhere starting from the age of 28 is prevention of aging and getting deep wrinkles, and injectables could start to be used then.
With, I know one of the facials that I had was the one that's very hydrating, and you said Jennifer Lopez uses this one.
The oxygen.
The oxygen facial, and that you said just like fills up the skin and kind of gives it the elasticity that you start losing. So what's in that? Can we give that secret away or no?
There's a few different serums that we use that we infuse with it looks like a pen actually. That we infuse. It's an airbrush pen. It takes a little time. It's very refreshing. It's cool. So it's a nice summertime treatment, and it plumps the skin, and it gives you that rested appearance. So, and if you have to apply makeup on top of that, which is nice to do before you go to an event,
right?
It's really effective.
So that's kind of one of the tips that celebrities use and will always do before an event. But for the average person, that can get kind of costly, I'm sure.
Not too bad.
Really?
No.
I mean, your skin is all that you have, so you probably should put an investment in that other than the quart of vodka.
Probably better.
Probably a good one. We have our first caller, Cassandra in the UK. Welcome, Cassandra.
Thank you, Diana, and hi to your guests. Quite a fascinating subject, and I'm pleased that you mentioned about the diet and the exercise as being part of the regime. What about the effects, the genetic effects? I mean, some people come from families where it's more, you know, you age less quickly. How do you factor in this when you're determining a regime for somebody? Thank you.
That's an excellent question. When someone first comes into the spa, we do a consultation and we do a skin typing. And skin typing has to do with what color your skin is, what type of skin is, your genetic hereditary history, meaning where did your family come from. All those have to do with your skin typing. Now, based on your skin typing, certain products may be better than other products based on your skin type. Some people may need additional protection more than other people. And certain treatments may be better for certain people with lighter skin tones, people who have genetic history of skin cancer, skin damage, early aging, may need other treatments earlier on as well as later on, but certainly starting earlier on in order to protect their skin.
That's a good answer. I mean, I think a lot does come down to genes, unfortunately. Like, I look at my family, and they've aged well, and I think, all right, I'm going to be fine. But then sometimes you see people who are 35 and look like they're 45, and you think, is that just an overall impact of, like you said, staying on the sun and taking care of your skin, drinking, smoking?
If you have the opportunity to see your family and how they age, it's definitely something that you're on that path too.
Right.
So.
And certainly if your family or you've known your parents, your grandparents, seem to have aged prematurely, that's a warning sign to you that you should be starting skin protection, skin treatments as early as possible to prevent these changes from occurring. Once they're there, there's things you can do to help it, but you're not reversing a lot of those changes that did occur. Mm-hmm. So if you know you're genetically predisposed to age quicker, that's even more of a reason to start doing things earlier, being more cautious in the sunlight, and really taking care of your skin before there's a problem, and really being preventative instead of waiting until after the fact.
My question, going back to the fillers, is that everything is Botox, Botox, Botox. People keep talking about preventative Botox, Botox when you get older. Is there a time, like you said, 28, Rose, for people to start doing Botox? But I mean, I'm hearing women injecting their kids at 16 years old.
That's terrible.
It's terrible, right? Because you're weakening the muscle.
I can't even.
Right. I mean, over time, if you're repetitively injecting it, you could be not only relaxing the muscle, you could potentially weakening or atrophying, thinning out the muscle. Wow. So, like I said, anything done in moderation and appropriate timing and dosing, is important. Now, when you first start getting wrinkles, when everyone squints or makes a face, you're going to have a wrinkle.
Everyone does.
Even when a baby squints, they make a line. Okay, that's normal. Now, when you have lines, when you're not frowning, when you're not squinting, that's a time to consider some type of injectable. Now, there are other creams, moisturizers. Make sure you're maximizing the use of that. Mm-hmm. Make sure you're protecting yourself from the sun. If all those things fail and it's progressing more, then you're a possible candidate for something injectable, but certainly only in those areas where there's a problem.
My question is, with people who have such deep set lines, let's say a woman in her 60s, is it possible that Botox may not actually get rid of that wrinkle?
Right. I mean, it may tighten up that area, but if that line is so deep,
you can still see it, right?
It's folding a piece of paper and you can unfold it. But if I fold that piece of paper and I make a crease and I unfold it, I still see the crease.
Right.
So I'm not getting rid of everything because there may be too much depth to it. And that may be a person who may be appropriate for a filler in order to raise that skin up to give it a flat, smoother appearance.
Isn't there a new product that people are saying is going to rival Botox that is actually better than Botox out right now?
Well, there's a newer product on the market called Dysport, which a lot of people come in asking for. And it works very similar to say it's a botulinum toxin. It works in a very similar mechanism. And some earlier studies and what from patients report, it may appear to last longer, so it would need less frequent injections. And so it certainly seems to be quite effective. It's very hard for them to break in the market because the name Botox is so embedded in everyone's minds.
Right.
But certainly a great product and a great product to ask for because the prices for that tend to be maybe a little bit cheaper because it's trying to make a name for itself on the marketplace.
And in terms of fillers, what are the fillers that people are requesting using and how are they used?
There's several different types of fillers on the market, and there's also different types of fillers, meaning fillers is really a category, and we can break that down into fillers where it's just I'm adding pure volume, and that would be the Restylane, the Perlane, the Juvederm, which are hyaluronic acid, which is a natural protein which you normally have in your skin, and we're replacing that by injecting it in there. So we're filling it in with a thick, viscous jelly. You have a crease, you have a deep line,
nice, smooth.
we're filling it in. People also use that as a lip filler. It's just adding pure volume. Then you have the other type of fillers, which we call advanced fillers. Advanced fillers not only fill, but usually with less volume, meaning because it takes less of it to do so.
Oh.
And also it can do other things, meaning it can stimulate collagen, so the area tightens and fills in by itself.
So it's working
over
with
time.
the skin's component.
Right. That's what.
Right. So a lot of people
I
like
appreciate that product.
really tend to go that direction because a lot of times if you inject Restylane, it could be gone in 3 to 6 months, and then you need it again.
Right.
An advanced filler, Radiesse is one example where you can inject a smaller amount of it. Over time, it's turned into collagen and stimulates collagen production, which tightens your skin and firms your skin, and collagen is not made as much as you get older, so you can have a much more lasting effect of up to 12 months with something like Radiesse. So for a lot of people, for a long-term, more natural, less volume-esque look, some of the advanced fillers may be a good option to consider.
Well, I think what scares a lot of women and men from these fillers is you see a lot of Hollywood actors who almost look like
they have no contour anymore.
Yeah, they look like almost jelly. It's a very weird
They
look.
have very plump, They change their contour.
I think the goal should be a more natural appearance, and it's very easy to see a line and fill in that line, and it's very easy just to overfill.
Yeah.
You want a little bit, you want more, and they get obsessed with that.
But like you said, it's an addiction,
Right.
and it's up to the doctor to really make the patient feel as confident as they can to walk out of the office without overdoing it.
And saying, that's enough.
Right.
Like, no more. And have you ever had to actually turn, I think it's scary too, because some of the younger girls get so caught up in like, the Botox, the fillers on their mouths and whatever. And I had a girl I went to college with, and I swear her lips got bigger every 3 months.
Right.
And by the end of it, when we graduated, she was like, hi guys. I was like, oh. It was very scary.
Yeah, as a physician, you have to be able, you have to be able to say, listen, I'm not comfortable in doing that because you're a representation of me, my work, and my thought process. Let me do it the way I think it should be done, and then you decide whether you want more. I mean, our goal is to have a much more natural, subtle, I don't know what you had done. I don't think you had anything done.
Right.
You just look better, but I'm not sure why.
Why?
We want to keep the natural contours of your face. We want to replace whatever was lost over time. So there's a lot of ways of doing that naturally, subtly, without changing the contours of your face.
Well, a lot of postmenopausal women lose their lip shape. I know that was one complaint my mom always had. She said, I lost my lips, I lost my lips.
When you do your lips.
Yeah.
It really does. You do lose the volume in your lips, but overdoing it's not good.
That's scary.
But, I mean, the product can last in your lips for, goodness, up to a year.
Wow. Well, thank you so much for joining us today, and I want all of our viewers out there, especially if you're in the tri-state area in the United States, because this is an international show, you can go to fountainmedicalgroup.com, and you can also purchase products, I believe, on there as well. You guys do a wonderful group of products. I think it's Skin Medica.
Yep.
That is really sensational and definitely recommended. So thank you, Rose Gabrielle, for joining us, and Dr. Todd as well.
Thanks for having us. We really enjoyed ourselves.
And please come back this fall so we can find out all the cool offers that you guys have going at Fountain Medical Group. And we will see you guys tomorrow for a very special event with Deepak Chopra. It is a follow-up from our 7-part series, Soul of Leadership. We will actually be in Deepak's home base, his actual apartment building and his conference room with a big press event, doing a Q&A where you can all interact and ask questions about how to be a leader in your own life, your career, your family, and in your relationships. So we have that for you tomorrow. Thanks, guys, once again.
Thank you for having us.
See you tomorrow.
Bye.